Good afternoon. I'd like to thank CANTO and in particular its newest director, Mark Reynolds, as well as the Secretary General, Ms. Teresa Wankin, for giving me this opportunity to contribute to this year's new entrepreneurial panel. Greatly appreciated. I'd like to use the time to talk about what I think is the entrepreneurial opportunity of a lifetime, which my company, Zuma Healthcare Limited, has been looking at over the last few years. Beyond talking about our company's experience, I'd like to also invite you, the telecom companies of the region, to join us on this journey. A journey to tap this $100 million market, which is ripe for disruption, and that is the market for digital health services in the Caribbean. Throughout the globe, the healthcare industry is going through a fundamental shift. Even prior to the pandemic, factors such as rising input costs, labor shortages, and constricting margins were pushing healthcare organizations toward prioritizing investments in cloud and digital health technologies. Cloud-based digital health platforms can help offset the financial strain on health systems in two key ways: lowering ownership and maintenance costs and providing fixed payments. For one, cloud-based EHR systems typically don't require additional installation costs for new modules like revenue cycle management add-ons and server updates that come with traditional in-house EHR software, which rack up considerable upfront spending, anywhere from $1,200 to $500,000. Further, such systems allow organizations to forego costs associated with code upgrades and to opt for monthly recurring payments, which should help smaller organizations maintain predictability in their budgets and thus focus on other operational costs. As a bonus, large-scale adoption of cloud-based tech also has the opportunity to alleviate interoperability woes across stakeholders such as clinic systems, medical labs, and health insurance, for example, by streamlining storage and sharing of patient data to improve patient care. Aside from operational efficiency factors, the healthcare consumer is also changing. Traditional patient loyalty to a single primary care physician is waning. Increasingly, customer service factors such as self-scheduling, pricing transparency, practitioner engagement with the patient, and complementary hybrid and digital in-person channels are becoming the key choice factors in consumer engagement of health providers. There are also patients, that is, are also not afraid to switch providers that do not offer them an engaging digital and in-person experience. Even older demographics are adopting in ever-increasing numbers. Due to the pandemic, particularly older populations are avoiding scheduled medical visits in greater numbers due to fears around crowded waiting rooms and long waiting times. There's a large and increasing pent-up demand for digital options, including telehealth/telemedicine, for an increasing number of patients. And informed analysts and venture capitalists have taken notice. In 2010, digital firms attracted just 211 million in VC funding. In 2020, that figure increased to 14.82 billion. At Zuma Healthcare, we've been getting ready for the digital revolution that is on its way to the Caribbean swiftly. We've built a range of solutions in the digital health space for health boards and councils, for doctors and healthcare practices, as well as for health insurance management. Even though the data and statistics quoted are out of the US, and we know that there's a lag in adoption rates in the Caribbean, the pandemic has served to shorten adoption times and cause countries to face similar challenges and thus the need for similar solutions in much shorter cycles. Our own experience is we have seen adoption for a health board solution, for example, from the Dental Council of Trinidad and Tobago. The Opticians Council of Trinidad and Tobago has also contracted with us for an online interactive registry of their members, inclusive of appointment management. And even the Guyana Council of Dentists, with its 150 odd members, has recently signed up. The really exciting opportunity, however, is the revolutionized customer patient experience being offered by our brand new provider directory platform in combination with our clinic management premium solution. And here is where I'd like to pause to play a video which illustrates the revolutionized and simplified workflow. that's it. I hope you enjoyed our presentation and got some insights which I hope will inspire you to engage with us. We feel that telecom companies in particular would be great partners in our journey as we roll out to the different territories in the region. With your brand recognition and reach, coupled with our bespoke software, services, and experience, we can lead the digital transformation of the Caribbean health sector. Thank you again. Cheers.